So I'm going to try not to make this super lengthy or really detailed, but we wanted to go into a little bit more depth in terms of exercise during this Jumpstart meeting compared to we've done like 3 before, I think, and we didn't do a presentation or go into as much detail on exercise. But as you heard from Dr. Bixby, exercise is probably one of the most important things to get started with as soon as possible. And so we felt like, of all the potential topics to talk about, this was one of the best ones, in a meeting like this where we're trying, we could have had like a 6 or 8 hour meeting and covered a whole bunch of different things like sleep and, other areas. But we didn't want to have too long of a meeting. We wanted to give you some good information about something that you could do right now to improve your health and probably have an impact on your Parkinson's over the long term. So my name is Claire McLean. I'm a physical therapist. I specialize working with people who have Parkinson's. I did extra training after physical therapy school, and I've done a lot of continuing education specific to working with the population of people with Parkinson's, LSVT Big, the Power Moves, Rock Steady Boxing. Pretty much any training that exists, I take it and I learn and I try to implement it. And I really see, I think, what are somewhat unique outcomes with people with Parkinson's because of how we really try to administer exercise. And it's the same thing as working with a neurologist who really understands Parkinson's. You want to work with physical therapists and exercise professionals and occupational therapists and speech therapists, anyone in kind of the healthcare system. It's really ideal to work with people who understand Parkinson's because we have taken more training, we have more education, we've worked with a lot of people, we've had more opportunity to kind of trial and error things and see what works and what doesn't. And we're more likely to have worked with someone who's like you and kind of presents with similar symptoms and challenges. And so we can be more efficient in helping you kind of get to the point of where you need to be to really get the most out of exercise. So let me progress that slide. Okay, so I'm going to talk just a little bit about some success stories because I do think it's really important to kind of live your life in an inspired way. So to know that there are people doing well, living well with Parkinson's, to know that that's possible even after many years of Parkinson's, having that expectation that even if you're recently diagnosed within the past few years and you might feel like you don't know what to expect or what's going to happen and it's very stressful, to see people who are doing well, hopefully can be very inspiring and allow you to believe that the same thing is going to be possible for you. Believing that you can feel better, do better, and have an impact on your Parkinson's over the long term is what is going to motivate you to take action on that. If you don't think that exercise is going to help you or that you could feel better or do better, it's much less likely that you will take action and do the things that are actually going to help you feel better and do better. So you've got to believe it's possible. And then we'll talk a little bit about the research. There is so much research that supports exercise and how beneficial it can be. And then we'll talk about the specifics. So based on the science and my experience working with people, what do I recommend that you do? So we're going to try to do that in 40 minutes. So what I see in terms of the way that exercise can help is it can improve mobility for people, improve their quality of life. They can feel better, have less pain, have less fatigue, have more energy, be able to do just, the basic things in life easier. Moving around in bed, getting dressed in the morning, anything that you want to do, being able to do it easier and more efficiently. So much of our life is movement based. And so since Parkinson's affects movement, it tends to make movement slower, sometimes smaller. That kind of can slow down everything you do, or you might not feel as confident to do things in your life that you want to do. So exercise and practicing movements can help with that. I see that exercise can help people maintain improvement. So when people first start exercising, we see improvement, and then they're able to maintain that improvement over long periods of time. Because I have been specializing working with people with Parkinson's ever since I graduated from PT school 14 years ago, I have seen kind of the long-term effects of exercise. I have some clients now that I've been working with for 10 years who are doing better now than they were 10 years ago, or who are doing similarly now as they were 10 years ago, which is not it's not the expectation of what it means to live with Parkinson's. Parkinson's is considered a progressive diagnosis with expectation that things could get worse over time. And we're seeing that that isn't necessarily true. People can get better and stay better over long periods of time. We can also help address symptoms that are resistant to other types of treatment. So there are some symptoms in terms of, walking and balance that when you take medication may help to some degree, but actually exercising and working on those things can be sometimes even more beneficial than medication. It doesn't mean you don't take medication. Medication is very important, but there are just some things that medication doesn't totally fix. And so exercise is one of the best things to work on those kinds of things. Balance is one. Medication can help a little bit with balance, but there's almost nothing like training your balance to really improve it. And walking, for many people, medication helps their walking get a little bit better, but we also kind of need to retrain the brain for bigger and better walking as well. So exercise and medication together are really kind of the ideal scenario. It also can help people recover faster after an injury. So we've had members who are recently diagnosed with Parkinson's, but they do need maybe a surgery like a knee replacement. And the better shape you are in going into surgery, the faster you will recover after. And, we haven't had very many members, but I know some people who have had COVID over the past year. And there was lots of research showing that the healthier you are less likely to have a severe case of COVID. So exercise helps you stay healthy and then helps people recover faster afterwards. And just many examples, like Dr. Bixby talked about, sometimes people will have the flu and they won't be able to exercise for 10 days and they'll experience a decline in how they feel and their function. But if you've been exercising before, you are much more likely to be able to get back to that previous level faster. As opposed to kind of what would happen in many cases for people with Parkinson's is if they got sick or something happened, there could be a decline in function, and then that would be their new normal. And we're, as physical therapists, exercise professionals, other types of therapists, we are not on board with that. Like if someone has an illness or a decline, our goal is to get them back to where they were before. But it's hard work. It is not something that just happens automatically. It doesn't happen by doing gentle stretching or basic exercises. It takes hard work, but it pays off. And, the more you do exercise, the more you like it, hopefully, in most cases. But you do have to do the right kinds of things at the right level of intensity, and you have to progress correctly over time. There's so much that I would like to say about exercise that we won't even have time for today. I'm trying to keep this somewhat basic to just get you motivated to start doing some things. But, I'm available. You can contact me afterwards if you have more questions, or, you can get in touch with someone in your area or wherever you're going for exercise or for therapy and get kind of a follow-up if there are more questions. I can't, unfortunately, talk about everything that I want to talk about today, because then we'd be here till tomorrow, possibly. So one example, though, to hopefully get you inspired is one of our members who comes here. So I'm a physical therapist, but I actually run more of a wellness and exercise program. It's in Fountain Valley, Orange County. And so we have members who are coming on a regular basis for exercise, but it is a little bit different since our classes are taught by physical therapists. We're kind of bridging that gap between individual physical therapy and exercise classes. So it's a little bit different than some other exercise classes might be. So this is one of our members, Anne, and she is someone who I first started working with in individual physical therapy close to 10 years ago. She was diagnosed at 40. She's now 56. So she's had Parkinson's for 16 years. And she was working initially when she was first diagnosed with Parkinson's. And so she was not able to fit in exercise into her life. And if you are someone who's still working, we understand that fitting exercise in it can be very challenging. Therapies and many exercise classes happen during work hours. And so sometimes it's hard to access those things. So, we want to help though. So if that is a challenge that you have, let us know. We want to help you figure that out. And how can you start to fit exercise into your life, even if you're busy with work? But that may look different than someone who's retired and has more time in their day to be able to exercise. So she hadn't exercised for about the first 7-8 years after being diagnosed, but she got started in 2012. And at the time, she was pretty deconditioned, out of shape. She was taking quite a bit of medication. So LEDD stands for levodopa equivalent daily dose. So there's a formula where you can enter any medications that you take, not just carbidopa, levodopa, but others that are relevant to Parkinson's. And they're calculations for kind of how they all fit together. And so they can give you a number, and whatever you're taking all throughout the day, it adds up to a certain number. So she was taking about 1,500 milligrams at the time, and she was experiencing some side effects with those medications. She started exercising, and she has improved in terms of those side effects. And she actually was able to reduce the amount of medication she was taking without having an increase in Parkinson's symptoms. She feels better overall, and she is on a third less medication still now, 9 years after getting started with exercise. So that's where, Dr. Bixby talked about how for many people, they need to increase their dose over time. And that's really just because your brain isn't producing as much on its own. So you need to supplement with more. But exercise combined with medication can really impact that. And there are a lot of people who don't necessarily need to go up on their dose nearly as much when they're exercising consistently. And even during the pandemic, Anne came in and we were doing planks and burpee challenges and trying some different options. So this is her not too long ago doing some really challenging things. And this is 16 years after being diagnosed. So in this upper left, she's doing a plank on jungle gym straps. I could barely do this. I'm in my 30s. I exercise pretty consistently. I teach these classes, and I had so much trouble doing this. This is a extremely difficult maneuver, and she could do it. And then we're doing burpees with a weighted ball. We're doing burpees with a rope. We're doing a plank on an unstable surface. So this is really just to show, the incredible feats that are possible when you exercise consistently. So Anne exercises 5 days a week here with us. She does 1 to 2 hours of exercise a day. And if you're not exercising currently, that may seem like an insurmountable amount of exercise. So we're not recommending that anyone starts with that amount of exercise. Starting with 20 to 30 minutes is great. Over time, you may increase, but just to show what is possible. And this is someone who experiences, it's not that her Parkinson's progression has just been non-existent over time. She really is working hard to maintain her fitness and be able to accomplish these types of things. But this is what is possible. And then Dennis. So I'm showing you people who have had Parkinson's for quite a long time, even though we're talking about people who are newly diagnosed. If I showed you videos of people who are in the first 3 years, you might see, okay, yeah, they're doing great. But we wouldn't necessarily see, what I would say is important is really knowing what you do now and the long-term impact it can have on Parkinson's. Exercise can help you feel better, both in the short term, and it really can impact Parkinson's over the long term. So that's why I'm showing you people who've had Parkinson's for a long time. That may seem somewhat irrelevant to you since you've only had it for a short amount of time. But I think this is kind of the key is if we can show how much exercise impacts people who have had Parkinson's for 10, 15, 20 or more years, we really know that it's having a significant impact. So this is another one of my clients, Dennis. He has had Parkinson's for 20 years now. This is 8 years after he started exercising. So when I first met him, he was referred for physical therapy. He'd had a Parkinson's for 12 years already, and he had never been referred to physical therapy before, and he was not exercising. So that is, one key is you want to start with exercise before you feel like you need it. You don't want to wait, because our goal is to prevent progression and prevent you from experiencing more symptoms. And the right time to start is before you need it. If we wait until you need it, then we're kind of trying to reverse symptoms and then maintain that improvement over time. It's just a little bit harder. So Dennis already had some significant symptoms that he was experiencing, but he got better and he has maintained that improvement over a long period of time. So this shows him on the treadmill. When he first started, he was experiencing a symptom called festination, where his steps would get short and small. This is not something that everyone experiences. It's not something that people typically experience early on. He'd already had Parkinson's for 12 years, but it was a challenge for him. And so we did individual physical therapy, and then he continued with exercise afterwards. And so this video on the right shows him in 2019 walking better. He doesn't have to hold on anymore. His balance is better. He's taking bigger steps, and he had much better control. And these are the kinds of things that we see improve. And we have a video of him walking outside. So this is a symptom again. So this a little bit of extra movement in that left foot is a symptom that changing his medication didn't really impact that very much. But retraining his brain through doing the right kinds of exercise really helped him. Then you can see there's still a little bit of that movement, but it's better. He's walking faster, bigger arm swing, bigger steps, and less of that ankle movement. So exercise is not just about intensity, getting your heart rate up, which is important. It's really about retraining your brain for better movements. And when you practice doing things really well, you can improve and you can change how you move. You can improve how you balance. You can improve how you walk. Really, almost anything can be improved on if you're doing the right kind of exercise to work on that thing. So Dennis, 20 years after diagnosis, doing well. He also exercises 5 days a week. So you're going to hear a consistent theme where regular, consistent, somewhat frequent exercise is probably necessary to really get the most out of exercise and really benefit the most. It's kind of like your medication. Medication needs to be taken on a daily basis. Something like levodopa needs to be taken even multiple times a day because of how it's metabolized and how it functions. Exercise, you need your dose every day of exercise so that you feel good that day and so that you are getting that benefit of potentially increasing dopamine production or BDNF and all these other really positive things that happen with exercise that needs to happen consistently. I have more research and data on that, which I'll get to later. I talk way too much about everything. So one more example to be inspired by is Terry, who has had Parkinson's over 10 years. She's in her 70s. And she has consistently gotten better over time. She had a goal of being able to jump rope. You can see on the left side, when she first started, she was not able to jump rope, but she let me videotape her not jumping rope. This is something I would also suggest is anything that you want to be able to do better or differently, get it on camera. We all pretty much these days have phones and devices that can easily record. And so, getting some video and seeing how you move can be really helpful. And then it's very fun to see improvement over time. And if we hadn't captured these initial videos, it wouldn't be quite as dramatic to see the change that Terry experienced over 3 years. So 3 years later, she's older, she's had Parkinson's longer, and she is getting stronger and fitter and better. And I can tell you again for Terry, it's not easy work. She is challenged mentally, physically, emotionally by the exercise that we ask her to do, but the outcome is worth it. So just an example, and I will be totally honest. So for all three of these people who I'm showing you examples, I will tell you that all of them experienced a decline during COVID. So when COVID hit and we had to stop our in-person exercise classes, we did things online, but it's not quite the same as in person. And so all of them have experienced a decline. Terry right now is not able to jump rope. Does that mean she can't get back to jumping again? No. So we have a new goal. We are back in person. We're able to get started with exercise again. And there likely will be times, whether it's something like a global pandemic or a surgery or an illness, there may be times that you experience a setback, but that doesn't mean you can't get back to where you were before. So Terry is on, she is getting back to where she was before, Dennis, and we are all working together to get better again. But I do want to be totally honest that, COVID threw everybody for a loop. So if you experienced changes over the last year and a half, you are not alone. And the stress of the pandemic, not attending exercise classes, having our lives changed so dramatically, I think it would have been nearly impossible not to experience changes during that time. But just to know those changes don't have to be permanent. So the science, the research is just so strong. So there are many forms of exercise that are shown to improve symptoms and may have the potential to slow the progression of Parkinson's over time. It's really tough when people say, how often should I exercise and what should I do? It's not the same for everyone. So each person needs an individualized program for exercise, just like, again, with medication. Not everybody's going to take the exact same medication, the exact same dosage, the exact same timing. Exercise also really needs to be administered on an individual basis. So there are some general parameters that we can say in general, this is true for everyone, but some people may need less intensity to start with. Some people may need more intensity. Some people may need less frequency or more. So it really depends on your symptoms, what your goals are, and things like that. So all of these are forms of exercise that have been researched and shown to be able to improve how people are functioning. So aerobic exercise, which can be done through many different things. That could be going for a walk, but how you walk makes a big difference. This is usually not going out and walking your dog. If you walk your dog, unless you have a very athletic dog who is not sniffing things all the time, you're probably not walking fast enough to really get your heart rate up. So that activity of walking your dog is great. You get steps in, you're active. That is wonderful, but that's not the same as exercising intensely. So aerobic exercise, we really define that based on your heart rate and how it changes during exercise. So are you getting your heart rate above 60% of heart rate max? If not, it's movement, it's activity, it's great for you. It's not the same thing. So we need to be getting our heart rate up. That can happen through walking. If you are out there like doing a power walk, if you're hiking, if you're jogging, if you're cycling, but you may have to measure it. So we don't necessarily know. You could be working hard and not actually getting your heart rate up above 60%. So we highly recommend measuring your heart rate when you're exercising. So they're all different forms. Things like dancing and boxing can be aerobic, but they aren't always. So it depends on how much you're moving, how consistently, if you're taking rest breaks. There's just so many factors. And so again, that's why we recommend measuring your heart rate during exercise so that you know if you are getting your heart rate up or not. So you may love dancing and going to a dance class, and it has the potential to be aerobic. If you measure during class and you see, I'm working on these great skills of timing and rhythm and moving around the room, and I'm also getting my heart rate up, awesome. But if you see I'm not actually getting my heart rate up that high, it doesn't mean dancing isn't good for you. It's still great, but you probably should be doing something else separate from dancing that you know you can get your heart rate up with. So that may be walking on a treadmill or getting on a bike, or doing something else. So making sure that there are some things you do where you get your heart rate up. Balance training is very effective. Balance training tends to be low intensity. So you're working on things that are hard, but you're likely not really getting your heart rate up unless you're doing some crazy like parkour or ninja type training. Functional training often has to do with things like, working on agility, balance. If you notice moving around in bed is challenging, we might be practicing rolling and changing positions, going from sitting onto all fours, onto our back, onto our sides. That kind of functional movement is really important. For most people, it is not aerobic. Still important, but not aerobic. Strength training itself, if you are really lifting heavy weights, you are likely doing that slowly, really focusing on your form. You might be getting your heart rate up for parts of the exercise, but you might also not be. And if you need to rest in between, if you tracked your workout the whole time, maybe you're lifting weights for 45 minutes, if you're getting your heart rate up for small portions of that, that doesn't really fulfill kind of what the research says in terms of getting at least 30 minutes of aerobic exercise. So that's where there are just so many factors to consider. I do personally think that it's pretty difficult for someone with Parkinson's to understand all of this and really put together a comprehensive program for themselves. That's why we highly recommend attending classes, working with someone like a physical therapist or exercise professional who specializes in Parkinson's so they can help you get to what your ideal program is. Make sure you're doing the right kinds of things. Boxing is another one. Boxing can be very high intensity and aerobic, but it also can be very skilled and not so aerobic. We love to incorporate cognitive challenges into boxing and games and things like that. Those are all wonderful, but it may mean the more cognitive something is, the more you have to concentrate on what you're doing and how you're doing it. It may decrease the aerobic and the intensity piece. So those are all the things that have to be considered. And then Tai Chi, I think that Tai Chi tends to be very skilled and on the lower intensity form. I've never seen like a high intensity Tai Chi. Maybe it exists. But things like Tai Chi, yoga, Qigong can be wonderful. They are going to be on the more low intensity side. And you need some of both. You need some high intensity exercise. You need some maybe moderate and low intensity, all kind of put together in your program. Oh boy, so there's so much. So our goal with exercise both is to treat symptoms in the short term and also to slow disease progression over the long term. And aerobic exercise and tremor is a great example. So Dave had asked about tremor and saying, different kinds of exercise influence that tremor in different ways. And it is true that high intensity exercise sometimes can increase a tremor in the short term because oftentimes tremor is affected by tremor is affected by stress, and exercise is a form of stress. So especially higher intensity exercise is somewhat stressful for the body, but there's healthy stress, and then there's stress that may not be as healthy for you. So exercise is one of those things that is healthy, but you may notice short-term increase in your tremor. But like Dave said, but he feels better. So you want to keep doing that. Over time, you may notice that exercise doesn't increase the tremor as much because your brain and body get more and more used to that intensity. Or you might notice that it always does increase the tremor a little bit, and that is okay because the long-term benefits far outweigh that short-term increase in tremor, at least in most cases. If you are really struggling because every time you try to exercise, it's really exacerbating a symptom, again, that's when you need to work with a physical therapist so they can help you figure out what to do, how to modulate it. And in some cases, we do really need to start with lower intensity, and we need to slowly increase the intensity level over time. Not everyone can go from 0 to 100 in terms of intensity levels and expect to feel good. And a lot of times that's what happens. People aren't really active or exercising. They go and do something that's a little bit too intense. They feel bad. And then they think, okay, exercise isn't good for me. I'm sore. I'm really tired. I feel terrible. So I shouldn't be exercising. That's not the answer. The answer is you need to back off in terms of intensity, do the right things for you, and slowly work your way up over time. And figuring out what that right intensity is and slowly working your way up is something that's hard to do. We're kind of all or nothing, a lot of us, like, okay, I'm going to rest today, and then tomorrow I'm going to go hard. And then, oh, I'm tired, so I'm going to rest. And that's not really what's going to help us feel better. More consistent, kind of moderate intensity to start with, working up over time is what will likely be more beneficial. So there are some great review articles that talk about all the beneficial effects of exercise. So exercise can help prevent cardiovascular complications. Our heart health is extremely important, whether or not we have Parkinson's. And when it comes to having Parkinson's, you really want to make sure that the rest of your health is as good as possible. If you have Parkinson's and heart disease, that is more challenging to manage than if you just have Parkinson's disease. So that's what exercise can really help reduce your risk of other health conditions that will impact you. Arrest of osteoporosis. So Parkinson's does not cause osteoporosis, but if you're less active, that can contribute to your bones not being as strong. Exercise is one of the best things you can do to improve bone strength and maintain bone strength. And bone strength is very important because falls are something that people with Parkinson's can experience. Anyone really can experience it. If you have a fall and no injury, it's kind of not that big of a deal, although we want to avoid falls completely if possible. But a fall with an injury is when there really can be significant repercussions from that. So we want our bones to be strong so that we are healthy. And also exercise helps even just joint health. So joint health and reducing pain and feeling better when you're moving is very important. Exercise can improve cognitive function. That's critically important. Prevention of depression. So exercise can really help with mood, anxiety, depression. It can help in many ways. And that is also a very important thing to address because Parkinson's can come along with depression. Sometimes it is just receiving a life-altering diagnosis can cause just your whole world to change and you have to figure things out. There also can be actual chemical changes due to Parkinson's, the changes in dopamine and serotonin, all those things that Dr. Bixby talked about. Changes in those neurotransmitters can also affect depression. So exercise can help both because you can feel empowered by exercise and like you're being proactive, you're taking charge of your own health care and, and your own health in general. So that can help with depression in that sense. And then exercise can actually have chemical changes that can help with kind of the chemical reasons for having depression and anxiety and other mood changes. Exercise can help with sleep. Exercise can help with digestion and reducing constipation. It can decrease fatigue. So initially, when you start exercising, you may experience more fatigue, especially if you were kind of out of shape to start with, but over time, it will help. And again, doing the right amount, the right intensity, being consistent with exercise, those are all really important to actually experience these benefits. You can experience improved functional motor performance, so you can actually just move better, faster, easier, bigger. It can help your medication work better, both in the short term and in the long term. and it can help the actual brain and the dopaminergic system in your brain function better. So it's pretty amazing what exercise can do. This is why, Dr. Bixby was saying exercise, 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 because it is really amazing. And instead of like, when you look at all these symptoms, if you were trying to treat those with medication, in many cases, it would be a different medication for each one. And our goal is to take the medications you need, but try to keep your plan as simple as possible, because the more medications you're on, the more potential there is for interaction and side effects. So yes, you need to take what you need, but ideally we do want to try to treat the rest of your health as much as possible through other methods so that you don't have to be on a different medication for all these different symptoms. So exercise can help with all of these all at once. Dr. Alskog is one of my favorite neurologists. He's at the Mayo Clinic in Minnesota. So if you're in that part of the country, you could see him. He's still practicing, but he has been a neurologist for like 30 plus years. I think he might be in his late 60s or even early 70s. He's a very experienced movement disorders neurologist. He has a PhD, and he is extremely supportive of exercise just because it's what the research says works. So a lot of neurologists maybe aren't as well versed in all the exercise research. They're very focused on medications and treatments. That's diagnosis and medical treatment is kind of their main focus. But he's written a number of articles, and then he wrote a book, which I put in the chat, that is a great resource for all things related to Parkinson's. And what he talks about here is conclusion from all this evidence, looking at all these different studies, is that regular aerobic type exercise that leads to fitness is the single strategy with compelling evidence for slowing Parkinson's disease progression. All people with Parkinson's should be encouraged to engage in regular such exercise. So strong words from a neurologist. So I mentioned earlier, I kind of already got into this, that of all these different types of exercise, many of them could be aerobic depending on how you're doing them, but they are not necessarily aerobic. And so that's where you really have to maybe monitor, be honest with yourself. Are you getting sweaty and out of breath when you're exercising? Because in many cases, I would say people are doing something, they're moving, they're exercising, but they're not really getting to that 60% heart rate max. They're not really getting their heart rate up. And that might be why you're not experiencing the benefits from the exercise you're doing or experiencing as much benefit. This really supports that as well. So it's this article, Forced Not Voluntary Exercise Improves Motor Function in Parkinson's Disease Patients. So this is one of the cycling studies that came out of Cleveland Clinic. Jay Alberts is an awesome researcher who has done a lot of work in his lab. So in this study, they took people with Parkinson's, split them into two groups. One was on a tandem bike where there was a professional cyclist, a trainer in the front. They were on the back of the tandem, and they were being challenged to pedal at 80 to 90 RPMs, faster than what was comfortable for them. And they were worked hard enough so that they got their heart rate into that 60 to 80% of heart rate range. The other group was voluntary exercise. So they were on a recumbent bike. They were allowed to control for the speed that they pedaled, but they also were challenged to work between 60 to 80% heart rate max. And the group that was pedaling faster and being challenged to do more than what they felt comfortable with is the group that got better. So both groups improved in their fitness levels, but the ones who really showed brain changes are the group that were challenged to work outside of their comfort zone. So aerobic exercise is important. And then also you need to do new and different things, and you need to be challenged to work outside your comfort zone. And again, this is something that is hard to do on your own. So I highly recommend working with a physical therapist, working with a trainer, joining exercise classes. That is one of the best ways that you can be challenged to do new and different things and work outside your zone. I mentioned earlier, people said they do physical therapy and then they have a home exercise program, but they're maybe not motivated to do it at home. Most of us are not motivated to exercise on our own at home. There is a subset of the population who is actually motivated to exercise. That's, like 10 or 15% of the population. Most of us are happy to relax and do things that are a little bit more low key. And especially once you have Parkinson's, to know exactly what you should do and how you should do it, and to progress over time and try new things I just personally don't think that's really realistic to ask people to do. Olympic athletes are good at what they do, and nobody says go train and exercise by yourself. They have coaches and trainers and people with them to to give them feedback, to challenge them in new and different ways. So I personally don't think that it's realistic to expect someone with Parkinson's to exercise on their own and be able to do all of these things. So finding in, services, therapy, classes in your area is ideal. If you live in an area where there aren't any classes and you can't find a physical therapist who specializes in Parkinson's, the good news is there are a lot more resources online now as well. So there's at least a place to get started, and then you can go from there. But there are online programs. We have one, and there's multiple other programs out there that are all, well, not all of them are great, but I'm sure a lot of them are great. Some medium, probably. We need to move more. So this is another review article that just talks about all the amazing things that exercise does. So exercise is shown to have powerful effects on Parkinson's based on several neurobiological mechanisms. So if you have ever heard or kind of looked it up, you'll see Parkinson's, there isn't just one cause of Parkinson's. There's multiple different things going on at the level of the cells and how the brain is functioning. And there's a lot of research happening now to see, are there, different treatments, a medication, injections, vaccines, stem cells, lots of different treatments that ideally could address some of these changes that are occurring with Parkinson's. But the cool thing is a lot of these things that are associated with Parkinson's and are negative can actually be improved with exercise. So physical exercise reduces chronic oxidative stress. So that's one of the things. Oxidative stress is negative for Parkinson's. It's related to getting Parkinson's. Exercise is actually one of the things that can reduce that. It stimulates mitochondria biogenesis. So mitochondria are the energy part of our cells and very important for us functioning well. Upregulation of autophagy in PD patients. So not to get too technical, but part of what's going on with Parkinson's is a protein called alpha-synuclein. It gets misfolded and it causes the cell not to function well. And part of the problem with Parkinson's is that the cells aren't getting rid of that misfolded protein. There is a problem with they call it garbage disposal machinery. It's not getting that bad protein out. Autophagy is cleaning up the cells, and exercise has been shown to upregulate the cleaning up of the cells in our actual brain. So all these exercise is not just for our muscles, it's not just for our heart. It really does some amazing biological things in our cells, in our brain. Antioxidant enzymes become more active and effective in response to physical exercise. Antioxidants are super important for brain health. We all know that. Well, most of us have probably heard about that at least. Exercise stimulates neurotransmitter and trophic factor synthesis. So exercise has actually been shown to increase dopamine production, and BDNF and GDNF. These are things that are being looked at in research. How can BDNF really helps the brain function better? How can that be implanted into the brain? Well, guess what? You could exercise and that could do a lot for the brain as well. So these neurochemical phenomena promote neuroplasticity, which in turn decreases neural apoptosis, that is cellular death. So it decreases those cells dying and may delay the neurodegenerative process, preventing or decreasing Parkinson's development and symptoms respectively. So before people are diagnosed, if they're at increased risk, exercise could help decrease their risk of getting Parkinson's or prolonged symptoms. Once you are diagnosed, you can really impact your progression over time through these, gross motor, muscle strength, and blood flow types of things, and also what is actually happening at the level of the cells in your brain. It's pretty amazing. So this is that study that showed, it was the first study that showed that exercise actually increased release of dopamine. Prior to this, exercise hadn't actually been shown to increase production of dopamine. It just showed that the brain functioned better. But now there are multiple studies showing exercise actually does increase dopamine production in the brain. So that's likely why more consistent exercise allows people to reduce medication or stay on the same medication over long periods of time. That's why it really can work well with medication. But you have to be able to exercise intensely. So that's where I see for some people who are under medicated or not on medication, if they aren't able to exercise and move in a way to get their heart rate up, they aren't able to get the benefit of the exercise. So that's why medication can be really important. So what kind of exercise should you do? So there are two main categories of types of exercise you need to do. One is aerobic exercise. You need to be getting your heart rate up. The other main category is skill-based exercise. So you need to be doing things where your brain is challenged to figure out what you're doing. So skill-based exercise is something like Tai Chi, balance training, boxing, lots of things where you are learning new skills and doing things differently and better than you have before. Amplitude training is another area. Working on moving bigger and faster for, any type of exercise you're doing is very important. There can be overlap. So boxing can be aerobic and skilled at the same time. Even walking can be both at the same time. So walking on a treadmill where you're walking with big steps and you're swinging your arms, there can be a skilled aspect to that. It's maybe a little bit more towards aerobic, not super skilled compared to something like boxing, but there can be overlap. And so you definitely can do forms of exercise where you get both benefits at the same time. But having kind of a variety of exercises you do, focusing on different types of things is really important. And then this is just a cool slide from Dr. Petzinger, who's a neurologist up at USC. She does exercise research. And so they say we need to do aerobic exercise, goal-directed motor learning. That's the skill-based exercise. And when we do those types of exercise, we see improved synapses in our brain, improved neurotransmitter production, receptors function better, dendritic spines on our neurons are stronger and connect better. We see improved trophic factors, blood flow, the immune system functions better, neurogenesis, actually building new neural pathways, and improved metabolism. These together improve the circuitry in the brain and the basal ganglia and the cortex. I know these are a lot of kind of technical terms, but I just really want to impart the fact that exercise is, not just basic, like get your heart pumping. It is doing some amazing things for the nervous system and for the brain. And so when these areas function better and they connect better, then we see improved movement, we see improved cognition and improved mood. All of the things that are very, very important for people with Parkinson's. So this training big to move faster. So one of the key symptoms of Parkinson's, like Dr. Bixby mentioned, is slowness of movement. Most people with Parkinson's will have some degree of slowness of movement. It could be mild or more significant. And to overcome that, you actually, as opposed to thinking about moving fast all the time, because if you try to move fast, a lot of times we have fast, small movements. But if you try to move bigger, you move bigger and faster. So no matter what you're doing, if you're doing Tai Chi, you really want to stretch out and do a full range of motion with your movements. If you're boxing, you don't just want to do little boxes here. You want to make sure that you are stretching those punches out. So no matter what exercise you're doing, you want to make sure to move big and really stretch. That's going to help you work on your posture, maintain range of motion in your joints, and retrain your brain for those better and bigger movements. Just to summarize again, so within any of these exercises you're doing, you can make sure to do it big. So aerobic exercise, if you are walking, you want to walk big steps. If you're doing functional training, you want to do it big. If you're strength training, you want to make sure to go through the full range of motion with the exercises you're doing. Bicep curls are not just in this middle range. You want to bend all the way and straighten all the way. So you can incorporate this big training into anything you do. Dancing, you want to move big with your dancing, nice and dramatic. Boxing, you can move big, and Tai Chi, like I mentioned. So this is what intensity looks like. So we have aerobic exercise classes actually because, even though you might think, well, riding a bike or walking on a treadmill is pretty basic and I could do that myself. You might be able to, but you might not do it quite as intensely as you should. And being in a class around other people is very motivating. We can play good music. We do intervals. We will encourage you to do more than you think you can do. Ellipticals are a very challenging piece of equipment. A lot of times people will get on and they find it hard and they just get off. We're there to coach you and say, keep going, try to do 1 more minute. Even if you do 5 minutes on the elliptical the first time or 3 minutes, we'll say, okay, each time you come back, let's try to do a little bit more. And over time, we can work up to doing the elliptical for maybe 30 minutes. But a lot of times you aren't going to be able to do that the first time you exercise. And so people will say, I tried the elliptical, it's too hard, I don't use it. That's not really the answer. The answer is to do it for a short amount of time and over time, build up the amount of time that you use that piece of equipment for. So here's showing one of our members. The music is great. It helps you go to a beat. The elliptical is a great piece of equipment to use because you can move, you're moving your arms, you're moving your legs. It's quite challenging. And then you saw, we moved over, Terry was jogging on the treadmill. And then our member here is on the bike. People are pushing to go faster than what feels comfortable. And that's how you get better, is doing more than what's comfortable. Then here, Terry, who I showed you earlier. So this is her recently. So even though there was a setback with COVID, she is working on getting back to where she was. We're working on getting back to jump roping. And she has been jogging on the treadmill recently, which is something that she would never do, on her own. So those are the kinds of things. We're there to make sure you're safe while you're doing something and that you're challenging yourself to do more than what's comfortable. And then here, again, on the bike, there's some specific things. On the bike, 80 to 90 RPMs is our goal. If you're not able to do that yet, we're working our way up to it. But you want to have some goals like that and be pushing yourself outside of your comfort zone. And then, like I said, monitoring heart rate is really important. So whether you have a Fitbit or an Apple Watch or a Polar monitor, we use Scosh monitors. There's lots of different heart rate monitors on the market. We have an app where we display it up on a TV so we can see, all of us, where our heart rates are. It's very motivating to see this information. And then you're doing the right kind of thing. So here you can see if someone's in the gray, that means they're below 60% heart rate range. So it's easy to see if you're in the right range or not. Blue means that you're in the 60 to 70% range. Green means you're in 70 to 80. Orange means you're in 80 to 90. And red means you're between 90 and 100, or even I think above 100, it would still be red. So our goal is first to get in the blue zone and then ideally kind of the green zone. A little bit of orange zone is okay. If someone is in the red zone, that is where we might say this exercise might actually be too intense for you. We have had some people who are exercising and they look fine while they're doing it, but then they'll say, I feel bad afterwards. I feel really tired. It takes me a couple of days to recover. And that is not what should happen with exercise. You should maybe be tired and feel like you got worked out, maybe be a little bit sore, and maybe be sore for a day or two, but you shouldn't feel like you can't move and do the things that you want to do. In some cases, we actually do need to decrease that intensity and work our way over time to those higher intensities. So this heart rate monitoring really gives us a lot of information. And this is something you can do on your own. You can have a monitor, you can wear something on your wrist, or use an iPad or a phone or something like that. There's a lot of options for how to incorporate this. When it comes to skill-based intensity, so here's a boxing class, and boxing is not just boxing. If you go to a place where a boxer is who leads the boxing, like a Rocksteady boxing class, it will be much more focused on like really kind of true boxing. If you go to many classes in the community, we're incorporating boxing, but also lots of other types of exercise. So here we've got the ropes. And the point I wanted to make here is boxing is a great form of exercise, but there are also some tweaks we can do to really optimize it for people with Parkinson's. So here, this is a very powerful movement. What we are working on here is posture. So him coming all the way up and stretching, he's working on posture before amplitude and effort and hitting that bag. Here, we're working on twisting back and forth with those bags. Here with one step up, we're working on balance as we hit those bags. The ropes are very difficult and work on rhythm and timing, which is very important to work on. Here with these double end bags, we had gloves off and open hands to work on stretching those fingers and working our hands in different ways. So there is just so much that can be done. This is why you want to work with someone, because our whole life, honestly, most of my life is about thinking of the ways that we can help people exercise better, feel better, do more. We love coming up with these exercises and making them fun and challenging at the same time. You want to find someone like me that you can work with in your area. Here's another example. This is from our circuit class. We are doing jumping jacks. We're getting our heart rate up. We're doing kettlebell swings, another one that's really great for working on hip strength, flexibility. Here we are lifting heavy weights. We have like 25, 30-pound weights that we're working on lifting. Here's our functional mobility practice, scooting around to targets. These kinds of things can be very challenging, even for people who are newly diagnosed and young. A little more kettlebells, working on that rhythm and timing. working on core strength, twisting. There are some specific areas that tend to be affected for people with Parkinson's. And so we're thinking about those things and incorporating them into our classes. Here we're doing some cognitive challenge. So we are flipping over playing cards. If it's black, you do a squat. If it's red, you jump. So there are just so many things that can be incorporated. More cognitive training here. Different colors, stepping, balance exercises, and then floor exercises are super important. Working on our strength, our posture, flexibility, getting into all different positions, on all fours, half kneeling, on our stomach, on our back. And these are the kinds of things that are going to help you feel better and move better throughout your day. All right, moving along. So what should you do? The question. So what the research says is ideally you do want to shoot for 6 to 7 days a week of exercise, not high intensity every single day. So that's what I think is important. High intensity every day you would not feel good doing that. But you want to move and do something ideally every day. If you have a goal of moving and exercising 6 to 7 days a week, even if you miss a day or two, you'll still get in a good number of days. And that consistency is important. The research that showed increased dopamine production for people who exercised, it was when they exercised is when they produced more dopamine. So they had to be exercising consistently, and then they had to do the exercise on that day. So a lot of times people will say, I feel better on the day that I exercise, not as good on the day I don't. It probably is because you're producing different amounts of dopamine on different days. So that consistency is very important. The amount of time that you spend exercising, as little as 10 minutes can be helpful, but most of the research is between 30 to 60 minutes of exercise. One reason that that's what most of the research is because when someone does a research study, they have to think about what is the minimum we can do that we expect to be helpful and what can we reasonably ask people to participate in. So most studies are 30 to 60 minutes, kind of 3 to 5 days a week. But in my experience, being in the community and running classes, we have a lot of people who are doing 2 classes in a day. And all of the people, Dennis, Ann, and Terry, who I showed earlier, are all doing an hour a day, at least 5 days a week, and sometimes doing 2 hours a day. Again, I'm not saying this to overwhelm you. That is not something you should be doing right now, but it is not totally unreasonable to be active for, multiple hours in the day. And when you move, you're likely going to feel better. So sometimes people will do some higher intensity earlier in the day, and then maybe they go for a walk and walk the dog later in the day. Things like that can count. I saw a question earlier that was, is there such a thing as doing too much exercise? Yes, there definitely is. Most of us are not doing that. But there is such a thing as too intense. There is such a thing as too much exercise. And some people do that. So that's where you want to talk to someone to make sure your plan is optimized. So 6 to 7 days a week, 30 to 60 minutes in most cases, but up to longer than that. We want to do a variety of types of exercise. We want to do a variety of intensity of exercise. High intensity exercise should ideally happen 3 to 4 times a week. You do need to do it enough to really make a difference, but you don't want to do it every day because your body does need a chance to rest and recover. There are exercises like the power moves that tend to be more moderate intensity. And those I think of as like the gift we give our body to feel better and move better in between the days that we do the higher intensity. If pain or balance limit your exercise, that's when you need to see a physical therapist so they can help you figure out the right kinds of things to do, the right amount, the right intensity, get a plan, and know how to progress over time. You do need to work harder than what feels comfortable. So if you're able to do that on your own, great. If not, again, work with someone. Ideally, work with a physical therapist who specializes in Parkinson's, who can help make sure you're on the right track, do some assessments and test you, make sure you're on the right program. And there should be a line here, joining exercise classes is one of the best things I think you can do because the camaraderie, the social aspect is wonderful. Having people, having that resource of the people leading the exercise class who specialize in Parkinson's. They are a wealth of knowledge. You can ask questions. They can let you know the kinds of things that you should be talking to your neurologist about. And then we are the ones who are coming up with all sorts of new and different things to challenge you. And we're watching you move and giving you feedback so that when you're exercising, you can do it with the best quality movement. So you're really retraining those pathways in the best way possible. So this is the research that supports why You need to exercise more frequently. So Dr. Mishley is a naturopath up in Seattle who specializes working with people with Parkinson's. She has some of the best research that compares different numbers of days of exercise. So what her research shows is that if you're exercising 2 or less days per week, it essentially has no impact on Parkinson's symptoms. It's better, 2 days is better than not exercising at all. But when people get to exercising 3 days a week, they actually show an improvement in their Parkinson's, and each additional day is additionally beneficial. So 3 is really the absolute minimum if you're wanting to have an impact on your Parkinson's. Each additional day is additionally beneficial. So aerobic exercise, skill-based training are kind of the things that you want to combine together. Here is aerobic training. Here is someone who's doing aerobic and skill. So we are really working on how he is walking. We're having him take bigger steps, work on his posture. This is often why you need feedback, because these are things that would be hard for him to correct himself. He is newly diagnosed, but he already had some pretty significant symptoms. So we needed to make sure to work on those right away. And Terry getting back into it after the pandemic, getting those legs moving faster on the bike. So you want to measure your heart rate to make sure you're doing things intensely, things to think about. So you have to make a plan. You have to be, proactive in terms of exercise. Exercise isn't something that's going to happen just out of the blue. You'll be like, oh, okay, I'm going to exercise right now. You have to make a plan. Which days are you going to exercise? At what time? Put it on your schedule. There are many, many other things in your life that could interfere with you getting started with exercise or doing your exercise. Household items, work, life, friends, family, grandchildren, spouses. So exercise is really something that you have to figure out how to prioritize. So it's got to go on your calendar, on your schedule. So which days, what time, what kind of exercise are you going to do? Check and see what classes you have available in your area. What equipment and resources do you have available? And really come up with a plan, and then do the best you can to be consistent and get help from professionals whenever it's needed. Okay, so 12. It's not bad. Not bad for me. I tend to go over a little bit.
You did well, Claire.
Whew, it was a lot. I know I talked fast, and I know Lauren did mention how, let me just stop my share really quickly. Lauren did mention how this presentation is recorded. So if I was speaking too quickly, which I totally 100% know that I was, this presentation will be available to watch again. On YouTube, you might even be able to slow it down. You could say I want to listen to this at 0.5 speed, but you can watch it again, take some notes, think about things, and so it'll be available again. All right, Lauren, any questions that I didn't cover that you think we need to address?
Well, as I had my questions, I kept crossing them off because you kept hitting them as you went on. I think it can be overwhelming to people to hear all this, especially when you're newly diagnosed. I know for me, I wasn't a big exerciser when I was diagnosed. So I just want to encourage people, don't be overwhelmed. You don't have to start, like Claire said, it's 6 or 7 days a week. You can work up to it, but it's so beneficial, and it's really, really important. But also, could you just touch on the importance of having an assessment, especially, when you're first getting started and all this, so you've got an expert looking at you, because we might not know that our foot isn't, working right, or our arm isn't swinging, because we think we're doing okay and we think we're moving big enough.
Yeah, because the thing with Parkinson's and symptoms is they come on slowly over time. It's not like from one day to the next things change. It happens slowly over time. And so your body and brain are kind of adjusting to that. So often people don't realize that they're moving a little bit slower, or that one arm isn't swinging, which is a very common thing with Parkinson's. Those are things that often will be noticed by an outsider, like a spouse or a neurologist. So an assessment can be very helpful, and that can be a physical therapy evaluation or an assessment as part of exercise classes. But we will be looking at things like balance, walking speed, endurance. There's a lot of different areas that we can look at. And the cool thing is there are age norms for many of the tests that we do. So we can look at, okay, you are a woman and you're 56. How does your walking speed and endurance and balance compare with women in your age range who do not have Parkinson's? Because that is our goal. That's what we're working towards, is you being the same and having the same functional ability as someone who doesn't have Parkinson's. And if someone is pretty far away from it, we aren't necessarily going to change that overnight, but we have something to work towards. Or when you're first diagnosed, we may see you are at age norms for all of these things. Great. And we want to keep it that way. So that assessment can be very valuable in seeing where are you and if there are specific areas that you maybe should be working on, because those are the areas that are below age norms. You know, if I asked you how long, if you're in your 60s, how long should you be able to stand on one leg to balance? You know, there are age norms and things like that are very correlated with your overall function and your balance and your risk of falls. So it matters, you know, both just because we're trying to keep you functioning similar to people in your age range, but also it matters for your function. And so that assessment can be very valuable to get. And then we set goals based on that assessment, and then we reassess. So the first time we do an assessment, we compare to age norms. Then 6 months later, when we reassess, we compare to age norms, and we also compare you to you. So if you are staying the same or getting better, great. If we see an area where there's a decline, we're like, okay, what's going on here? Is this something that is exercise related? Do we need to tweak the exercise program? Is this something that you need to talk to your doctor about? Do your medications need to be optimized a little bit? So that information from the assessment is just gives us so much information to work from and really to be able to be proactive. And I think a lot of people kind of don't want to see that information because there may be some desire to be in denial. You don't really want to know if something isn't good. You kind of don't want to know that. I totally understand that feeling. But if you stay in denial about it, it's really hard to do anything about it. And at a certain point, it will likely be significant enough that you sort of don't have a choice. And so it's better to notice things or test them early on and then be able to progress over time and be able to make improvements and make sure that you are getting better. So we want you to feel better. A self-assessment is important. And we also ideally want to see objective numbers changing over time and see improvement with that as well.
It's also, I think, like for me personally, to compare myself to myself, 1 year to the next. When the doctor says you've got a progressive neurodegenerative disease, I expected, to go downhill. Every day is going to be worse than the one before. But I had an assessment. You start your exercising, you start your medication, you start all these things you're supposed to do. A year later, some things are improved. But even if you haven't improved, if you've stayed the same, you're ahead of the game. You're doing awesome. That's not the general course for Parkinson's. So for me, it's really empowering to get those assessments and to see what point I'm at and to see the benefits objectively of my hard work.
Yeah. It's really important. Like it helps you to stay motivated to know that it's doing something.
Yeah. And then Claire, how would people find if they don't have a Claire in their area? How do they find a Claire? Someone, not just a regular, it's important, not just a general physical therapist, but you really need an expert in Parkinson's.
Yeah. So there are a few websites and we can put those in the chat. So one is there is an organization called LSVT Global. They do physical therapy training they do physical therapy and occupational therapists learn a program called LSVT Big, and they have speech therapy as well. So that's one place to look. LSVTglobal. It might be .org. I'm not sure if it's .org or .com. I'll have to look. And then Parkinson Wellness Recovery is an organization that specializes in exercise and therapy for people with Parkinson's as well. They also do courses. They do courses for physical and occupational therapists and also for fitness professionals. So you can look on powerforlife.org is their website, and you can search for therapists and exercise professionals in your area. Rocksteady Boxing has they do training and boxing specifically, and they train fitness professionals, and they also train, there are therapists. Like I have taken Rocksteady Boxing. So that's another place you can look to find classes in your area. You also might find, like there's an amazing physical therapist. I think now I'm blanking on her name. I follow her on Instagram and it's not her name. She's Rocksteady Boxing Pinehurst. She's in North Carolina. And she is a physical therapist who teaches Rocksteady Boxing. So people go to her classes, but she's also available for individual therapy. So there are situations like that as well, where a class might lead to physical therapists and vice versa. So those are the main places I would say to find people who really specialize in Parkinson's. Brian Grant Foundation, I believe, also has a listing of exercise classes. They have a training for fitness professionals. And then the American Physical Therapy Association, also has listings of physical therapists, but they are basically saying people who specialize in neuro. And so, Donna, that's not the same one that I'm thinking of. But so physical therapists specializing in neuro, if you don't find someone who really specializes in Parkinson's, if you go to the American Physical Therapy Association, you can look up people who specialize in neuro, and that would be better than kind of a general orthopedic physical therapist, because the research when it comes to like neuroplasticity and what we're trying to accomplish is very different than what kind of orthopedic physical therapy is, which is typically people rehabbing from surgeries or decreasing pain. That kind of physical therapy is very different than physical therapy for people with neurologic conditions. So that would be one more place to look, as the American Physical Therapy Association.